Hi, folks, for the people in the room. I'm seeing that we've got 32 folks here. We had well over 50 who had registered, so we're just taking a couple of minutes, maybe one more minute more, but we'll jump into this right away. I think we'll go ahead. Some of us are just here on our lunch hour. Our Toronto folks are at a different time zone, so I think we'll just jump right into it. So I wanted to say thank you all for making the time to join us today on this. My name is Kate Kaler. I'm the Executive Director of the Social Planning Council of Winnipeg. Back in 2020, we were pleased to be asked by Louise Simbundamwe of Seed Winnipeg to assist in developing the Police Accountability Coalition's initial position paper calling for substantial police and justice reform. We've continued to be a member of PAC ever since. I'll explain more about PAC in a bit. And while our Toronto guests will bring us their own land acknowledgement, we would like to begin with acknowledging that here in Winnipeg, we are on Treaty 1 territory, the traditional lands of the Anishinaabe, Innu, Oji-Cree, Dakota, and Dene peoples, and the homeland of the Métis Nation. We have long received our clean drinking water from Shoal Lake 40 on Treaty 3 territory, when the people of Shoal Lake only got access to clean drinking water in 2021 after 24 years of boil water advisories. Winnipeg also benefits from the electricity that is generated on Treaty 5 territory, which has done harm through displacement and to the traditional ways of living to some of those communities. We all know that it's important for land and treaty acknowledgements not to be just by rote performances, and we need to add something of the personal. For today, given the topic, what for some, due to direct lived experience or the experience of loved ones, can be very fraught and emotional, I'm just going to ask us all to commit to the idea that truth has to come before reconciliation. So if we can all commit to listening with not just our minds, with the mindset of responding to counter what we don't agree with, but with our hearts, with the goal of building some mutual understanding. A short history of PAC is we are 100 plus organizations. And back in 2020, which of course brings to mind George Floyd and the Black Lives Matter movement, but actually PAC also came together to address the fact that the provincial government at the time had actually done a review of the Police Services Act. And while they had rightly done a good job of consulting with Indigenous governance bodies, they had not talked to grassroots organizations and had not engaged at all with any sort of Black or other people of color organizations. In case you're looking at me and saying, why are you up here talking with this face? I am not usually the face of the Police Accountability Coalition. Unfortunately, our co-chairs weren't sure if they were going to make it here today. So that's why you have got me. But PAC has developed a number of position papers, and one of which is the case for a civilian-led crisis response. The goals of that is for people in medical crisis to receive a medical response first. The second is the Winnipeg Police Service no longer responds to calls for service that are outside their scope or expertise. A reduction in overall calls for service for the Winnipeg Police Service, and a better service to the community through a more effective and evidence-based evidence and community-based approach. So some of our context is we, and I use the collective we, even though not every people have worked in different ways to create change and all of that sort of thing, but we are in the situation that we are. And here in Winnipeg, the Winnipeg Police Service has become the default system to deal with all other systemic failures. Our poverty levels, the lack of mental health and addiction services, lack of housing supply, and the list can go on. But just some final facts for context. Winnipeg has just over 800,000 residents. Winnipeg has the largest urban Indigenous population of approximately 100,000 people. And back to that truth part, the ongoing harms of colonization are just that, they are ongoing. Winnipeg receives from 12 to 16,000 newcomers a year, many racialized, many coming from war-torn countries, so also dealing with trauma and mental health issues. We have a toxic drug supply that is quite literally poison and is killing hundreds yearly and doing severe damage to others. Winnipeg Centre has long been the urban federal riding with the highest rates of child and family poverty. The urban federal riding with the highest rates of child and family poverty. The latest data demonstrates that a full 41% of Winnipeg Centre's children and their families live in poverty. We all know that poverty can both create and exacerbate mental health issues. So having said all of that, I also want to add that we can do better than we have been because other jurisdictions are. So I'll take in a minute, I'll introduce our guests, but I'll let you know that while we did ask for questions to be submitted in advance, we didn't get any, but there is a Q&A function on the below of your screen. If you would like to add in a question now, there will be time at the end, and we'll address whatever questions we can then. If we can't get to them all, we commit to talking to our Toronto guests and getting those answers for you and sending them on, because we have your contact information. So I'd like to introduce our Toronto guests, and they'll explain their approach and the innovative approach they've taken to address these issues. So we have Dilia Niazova, who is the manager of the policing reform unit within the community safety and wellbeing section of the City of Toronto. Leanne Champagne and Andrea Morales are both policy development officers in that same unit. So I will turn it over to you, and thank you.
Thank you, Kate, and thank you everyone for having us here today. It's a really wonderful opportunity for us to learn more about your context, but also be able to share what we've been doing here in Toronto. I'll start off by acknowledging where we are, where Leanne, Andrea, and I are. As Kate mentioned, we are in Toronto, and we acknowledge that the land that we're meeting on is the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and it is now home to many diverse First Nations, Inuit, and Métis people. We are sitting on Treaty 13 territory with the Mississaugas of the Credit here in Toronto. Part of our work here at the City of Toronto is also to ensure that we are confronting anti-Black racism. And to that end, we do an African ancestral acknowledgement as part of our openings. So we acknowledge all treaty peoples, including those who came here as settlers, as migrants, either in generations or in this generation or in generations past, and those who came here involuntarily, particularly those brought to these lands as a result of the transatlantic slave trade and slavery. We pay tribute to those ancestors of African origin and descent. I'm going to start the presentation by setting a bit of context around how our Toronto Community Crisis Service came to be. We'll give you a little bit of a history and background and some of the work that we did to launch our service. We'll talk about what the service looks like, and then we'll end off with some evaluation outcomes around how the service is doing so far and what impact it has had. And then I'll close off with some high-level lessons learned, and then happy to take any questions if anything is not clear or if anything comes up for you as an area of interest. So I'm going to take us back to just 2020, I think, at this point, although we could go back a lot further in terms of where this work started, and specifically how long community has been advocating for a non-police-led response to mental health crises in this city. So back then, and again, prior to that, and even now, Toronto's mental health system was underfunded, overstretched, and reactive rather than preventative. There were a growing number of people who were experiencing mental health crises, and those people were turning to emergency rooms and police services for support. The Toronto Police Service has reported a 32% increase in person in crisis calls over the past years, with 1 in 5 police interactions across Canada involving someone with a mental illness or substance use issue. Relying on police as default responders, however, has presented serious risks, particularly for racialized folks, Indigenous folks, Black, and to us LGBTQ+. Furthermore, systemic racism and biases compounded these risks, often resulting in negative outcomes for some of the most vulnerable individuals in our communities. In particular, in the summer of 2020, when we found our opportunity and our window to push this work forward. As you'll remember, there were a number of high-profile deaths that involved police incidents in this city, including Regis Korchinski-Paquette, Chantal Moore, and of course, George Floyd. These incidents ignited widespread calls to defund and reform policing in many jurisdictions, including ours. In response, communities across Toronto continue to really push the City of Toronto to develop a non-police, trauma-informed harm reduction model for crisis response that builds trust and is cognizant of the particular needs of the diversity of folks who live in this city. I'm going to turn it over to my colleague Leanne to talk about some of the community engagement work that happened during this time that led to the development of the service.
Thanks, Delia. To conduct this work in a manner that reflects the needs and desires of those communities most impacted by over-policing, there was a clear need for community engagement and input. With this in mind, the policing reform team led a short but intensive period of community engagement and research. Outreach and engagement prioritize the communities that are most impacted by over-policing and that have lived experience of the mental health, substance use, and justice system. From October to December 2020, the team completed, and please keep in mind this was right in the depth of COVID. We did 33 community roundtables with over 500 participants focused specifically on historically marginalized and over-policed groups, 2 surveys with a combined response rate of 6,384 responses, 29 interviews with subject matter experts, conducted a public opinion poll with a representative sample of over 1,000 Torontonians. An alternative community safety response accountability table comprised of 56 diverse organizations was formed to monitor and support the development and implementation of the TCCS. Staff also conducted roundtables with relevant city divisions and agencies, including first responders, Toronto Fire Services, Toronto Paramedic Services, and met weekly with the Toronto Police Service. The team also reviewed and learned from 53 crisis response models from 50 jurisdictions across Canada and internationally, which we look at in more detail shortly. Now that we had this information, we put together the guiding principles of this service, but then we had to figure out how to operationalize it. And how does it actually work? What does the service do? What does it look like? Who will deliver it, and where will they deliver it? So for example, some of the guiding principles that came up were enable multiple coordinated pathways for clients to access crisis and support services. So meaning no wrong door approach. Ensure harm reduction principles and a trauma-informed approach are incorporated in all aspects of crisis response. Develop a transparent, consent-based care model of crisis response. Ensure service delivery is client-centric, culturally relevant, and allows for individualized support needs. A guarantee of accountability to service users' voices and outcomes by establishing clear pathways for complaints, issues, and data transparency.
Okay, thank you, Leanne. Now I'll get into some of the details around what the service is. So the TCCS is a made in Toronto approach. We started off the service in 2022 in 4 areas of the city as a pilot. We used Toronto Police Services mental health apprehension data as well as overdose data to deter, and of course, feedback from community around where these pilots should be. In July of 2024, we expanded citywide. And now we have the service is available everywhere in the city. We also became the 4th emergency response as part of that expansion. And we also do have a broader strategy, our community safety and well-being strategy, which is a provincial requirement that every municipality has one of these strategies. Ours is called SafetyO. It's our 10-year community safety and well-being plan, and the Toronto Community Crisis Service is one of the priority actions under this broad strategy. Okay, so in terms of the components of the service, it is 24/7, 365. Prior to the existence of Toronto Community Crisis Service, there were lots of other types of services that were trying to meet this particular need, but the 24/7 service component was really important, and community did let us know that it was important that it be accessible at any time of day, anywhere in the city. It is voluntary and consent-based, so we do not have the ability to apprehend. We don't have the ability to force people to take service, to enter into any kinds of services. And so that is an important, critical value of the service and component of the service. We work with clients over 16 years of age. At the moment, although we do provide services for families, which may include children under the age of 16, the service is trauma-informed and uses harm reduction principles. As Leanne mentioned, we have a no wrong door approach, and we have multiple intake channels, which I'll speak to in a moment. We have mobile crisis teams that respond to, that can be dispatched and respond to mental health crisis calls. And we also offer post-crisis follow-up and case management and service navigation for up to 90 days. The intention of this is to ensure that people get the services that they need and hopefully break the cycle of crisis that they find themselves in. And again, as mentioned, culturally relevant services and culturally appropriate referral networks are also an integral part of the service and have contributed to the positive impacts of the service and positive experience of service users who have accessed the service. In terms of the various roles that govern the service itself. So our role as the City of Toronto is to provide backbone support, intergovernmental advocacy, develop public education campaign, as well as identify and support the resourcing of the service. The service is currently resourced 100% from the municipal tax base. In terms of governance, we have, as Leanne mentioned, we have citywide community advisory tables as well as local advisory tables that provide input into how the service should run and provide that transparency in terms of how the service is unfolding. We have done multiple evaluations of the service since 2022. We've done 3 by a third party. They lead the monitoring, evaluation, and knowledge mobilization, including community of practice around crisis support. Our access and intake channel is through 211. They take the calls, they assess the calls, and dispatch the appropriate anchor partner teams. And we work with anchor agencies. So these are health service providers who are community-based, and they are funded to hire and manage the mobile crisis teams and provide wraparound supports and case management. And of course, our crisis teams are the ones who respond to calls. They are composed of multidisciplinary community-based crisis response teams, and often, as a standard, we have 2 crisis workers that must respond to every call. Okay, and then in terms of our community partners, we have 4 community anchor partners that deliver the service on the ground, and then we have our call taking and dispatch partner, which is Find Help 211. So I'll show you a map in the next slide, but I just wanted to show you that each of our partners has a specific strength and approach that they're bringing to the service, and each of their models is slightly different based on this strength and approach, and as well as the communities that they serve in the parts of the city that they operate in. So, for example, in the east part of the city called Scarborough, we have Taibu Community Health Center, who provides an Afrocentric approach to mental health and well-being. And each of our partners works in a larger local network. So they have 8 local partners in Scarborough. In the central Toronto and South Etobicoke area, we work with Gerstein Crisis Center. They've been providing crisis services for over 30 years. And their strengths are in providing a non-medical trauma-informed harm reduction approach. In North Etobicoke and North York, we have CMHA Toronto. They work with 11 local partners, and they have an anti-racist, anti-oppressive, and culturally safe approach. And then our Indigenous organization, I purposely missed them just now to go back, because they actually now provide citywide service for us. And so anyone who calls and requests an Indigenous service is able to access them. And of course, they use harm reduction and holistic health and wellness, as well as an Indigenous-led approach to deliver their service. And then finally, our call taking and dispatch partner is 211. They have an easy to remember 3-digit number like 911. And they are also able to connect folks to a number of other services, community services, health services that exist in Toronto. And they are able to provide this service in over 150 languages. So I'll show you the map next. This is how the service is delivered on the ground. So as you can see that on the right side, Scarborough is serviced by Taibu Community Health Center. The bottom half of the city is Gerstein Crisis Center. The top half is CMHA Toronto. And once again, our Indigenous service provider, Two Spirited People of the First Nations, provide service citywide. Okay. So in terms of how the service can be accessed and what the various components look like. So essentially, somebody would call us. It can be you calling for yourself. It can be your family member calling on your behalf, or it can be a neighbor or somebody on the street who sees that somebody's having a hard time. They would call. Our primary intake is through 211. However, we do divert calls from 911 as well as paramedic services. We also have, our partners have their own crisis lines. For example, our Indigenous partner has an Indigenous crisis line that is available 24 hours a day. So a call would come in, an assessment would be done, and we would be looking for appropriateness of the call as well as safety. So there's an assessment that happens around whether or not there are weapons present or the existence or potential for violence. If that's not the case, then our teams would be dispatched. They would arrive on scene. Our current average arrival time on scene is 33 minutes. Our vehicles do not have lights and sirens. So if you've ever been to Toronto, you know that that's an impressive time for arrival, and we do our best. Our teams are spread out throughout the city in order to be able to get to people as quickly as possible. Once they arrive on scene, they're going to do another assessment for safety, and they are going to connect with the person, ask them for their consent once again, and then they are going to provide all kinds of supports on scene, whether it be de-escalation, referrals, providing somebody with a sleeping bag or socks or whatever they may need. And then within 48 hours, they're going to reach out again and follow up and offer further supports, check in, offer case management, etc. I wanted to give you also a sense of the call type categories that we usually respond to. So we work with Toronto Police Services, and we have an MOU that we've developed jointly with them around the types of calls that we would divert from 911. These are the call types, as they call them. So there's thoughts of suicide and self-harm, person in crisis, well-being checks, disorderly behavior, disputes, and advised. And 911 would do an assessment of these calls, again, to ensure that it's appropriate, it's mental health related, and there are no weapons or violence, and then would transfer those calls to 211, who would do a further assessment and then dispatch the teams. And then I'm going to pass it over to my colleague, Leanne, now.
Thanks, Delia. So what does the TCCS look like? I'd like to acknowledge that all the photos used in this presentation are actual photos of our community anchor partners from CMHA Toronto. As you can see, they are wearing their organizational logo on their t-shirts, on hats. They also have bags that will identify them with their organization, and also that they are part of the TCCS. As Delia mentioned, there are several different approaches. So if this was a photo of Two-Spirited people of the First Nations, you would probably notice more of having the beaded lanyard and then having their own organizational logo, and then the identification that they are part of the TCCS. Our vehicles are the same overall for all the organizations. They mostly come in a white color. Our Toronto Community Crisis Service logo will be on the side, and also the number for 211 will also be on the side of the car. In the back, the City of Toronto logo will be visible, as well as the Toronto Community Crisis Service, again with the 211. What is universal with all organizations is that all workers and crisis workers must have a lanyard with their photo ID, with with their name, the organization that they come from, on at all times when they're providing service. So it's a way to make sure that we are able to identify ourselves to community and also to emergency responders if we come on site with other community service crisis responders. So what skill sets do our crisis workers have? So our crisis workers have a minimum of 5 years experience in community mental health, crisis intervention, case management, or related field, an educational background in health sciences, social work, health administration, or related discipline, experience in crisis intervention and de-escalation, experience in suicide, risk assessments, and interventions using the ASSIST model, experience working with issues related to substance use and concurrent disorders with harm reduction framework, experience to adapting interventions to a diverse client group, and personal experience of mental health and substance use challenges. Sorry. And what training do crisis workers receive? All crisis workers coming on board will complete over 200 of both classroom and scenario-based learning on core skills and foundational principles. I'm not going to go through every single training, but as you can see, each crisis worker will have 27 hours of foundational principle training. So things like harm reduction, trauma-informed care, staff well-being awareness and resilience. And then they have 85 hours of core skills, which is really important. So this would be like crisis intervention, de-escalation, so pharmacology. Also very important is to have the privacy and legislation training. So the Mental Health Act, the HIPAA, documentation skills, technical training. So we use three-way radios, we use cell phones. So making sure that everybody is aware of our standard operation procedures, 211 dispatch, radio technology, first aid, CPR, and naloxone training. And then, of course, also our system navigation, because we do work closely with 211 as there are dispatch. So having that training with 211 and how to make referrals, and then how to also connect with emergency services when needed. And then, of course, applied learning, which is about 71 hours. So working with undocumented Torontonians, newcomers in mental health, supporting youth and families, Indigenous communities, Black communities, neurodiversity and brain injuries. And then we also do a scenario training, which is actually very interesting because we do scenario training with the Toronto Police to often we get calls that both Toronto Police and other emergency services may show up. This helps navigate what needs to happen if all three or more emergency service show up on how to best navigate a crisis situation. And so this is all apply training that is a requirement upon coming on to the TCCS crisis service.
Okay, thanks, Leanne. Now that Delia and Lynn have talked about the history of the service and what it's composed of, I'm going to go over some of the stats and service user outcomes of the service to date. So in the slide over here, you'll see some of our major outcomes from the start of the pilot, so back in March 2022 to the end of 2024. So from that time period, we received almost 24,000 calls for service, and out of those calls, we had almost 20,000 instances where the mobile team were dispatched. In terms of the call source, as Delia mentioned, there's a no wrong door approach, but most of our calls have come in through either 211 or in the community sources, and about 42% have come from 911. This is actually kind of interesting because initially we got most of our calls from 911, and then over time, 201 became our leading call source for our TCCS. In terms of calls related to emergency service presence and request, we have what's called a 78% diversion rate. So that's calls that come in through the 911 source and are handled by our TCCS teams without police being observed before, during, or after an event. Our hospitalization rate is about 8%. So that is when someone needs to go to the emergency room. And the times that our teams request emergency services to come on the scene is about 3%, with about 1.7% of that being police service request. As Vila mentioned, we also pride ourselves in having follow-up supports and referrals. So within that same time period, we made over 6,000 referrals to community services, with over 1,000 of those being referrals to case management for service users. And as you can see on the right, that's one of our leading referrals, followed by other services such as mental health supports, psychiatric supports, housing supports, and primary care. As we mentioned before, we have our third-party evaluator, it's the Center for Addiction and Mental Health. And when they did their first year outcomes evaluation, they surveyed some of the service users that they recruited to see what their outcomes to the service were. And overwhelmingly, the service users had either positive or very positive experiences with the TCCS. And they reported having improved outcomes on community safety and well-being, that they have positive experience with the team overall, and that the supports that they received were the supports that they were requesting at the time, and that they were being connected to what they needed. These are also some of the stories of impact they collected in that time period. There's 3 of them over here. I'm not going to read over all of them, and just the one in the bottom. So this is from one of their actual service users that asked the TCCS during the pilot period, and they're saying, it's just such a feeling of comfort, and with that, the element of safety is present. I know that the service is there and it is safe. So this is from our latest evaluation. So we've done 3 evaluations so far, with our latest one being a service user focused evaluation that was released in March of 2025 of this year. So Center for Addiction and Mental Health recruited 35 participants, and they examined their experiences with the TCCS across the full continuum of care. So that's going from the initial call to 211 to the mobile team's response to the follow-up supports that they received from the community anchor partners. And overwhelmingly, the participants reported having a positive experience with the TCCS, and that the service was seen as filling a critical gap, and it offered an effective and alternative to traditional emergency responses that were out there in our ecosystem.
Okay, wonderful. Before we get to questions, maybe I'll just take a couple of minutes to wrap up and give you a high level kind of lessons learned for consideration in terms of your efforts in Winnipeg and what you'd like to do when it comes to responding to these types of calls. So I think what makes our service particularly unique and also impactful is the fact that first and foremost, we are community led. This is a service that was built by community, was advocated for by community for many, many years. And the principles and the guiding principles and the approach was developed by community. And that is really important because it's helped us build trust, especially with those folks who have had really negative experiences in the past. And also it has allowed us to leverage the expertise and the skills and the relationships that our community anchor partners have in the communities that they have long been working in order to reach people more and differently. So I think that's a really important one. I think the other piece is being non-police led. In Toronto, we have various efforts that have come forward that have been joint efforts, let's say, with Toronto Police Services and other emergency responses. This one needed to be non-police led, again, because that's what community said we needed here in this city, and that's what would work. And they were right, and I think our police colleagues agree as well. And on that note, I think partnership is a really important component of the service and reason for its success. We as the municipal government are partnered with community organizations as well as our emergency service colleagues, so paramedics, fire, and police services. And we work very closely with them around diverting calls, defining appropriate call types, working on scene together, doing joint training, any way that we can partner better and use our shared resources and knowledge and expertise to better serve Torontonians. We have been trying to do. And I think the other piece too is we are now considered the fourth emergency response in Toronto, along with Toronto Police, Fire, and Paramedics. And I think that's been a really important and strategic positioning of the service. And it talks to the need for us to work across all of the emergency service ecosystem, but also it speaks to the importance of mental health response in this city, and therefore the need for it to be adequately resourced, which is the lesson that I wanted to touch on. Arguably, the jurisdiction of health services is not a municipal area. However, this city decided, and the political leadership of the city decided that it needed to be resourced. However, it could be resourced, and they were able to do that from the tax base. Which is hopefully something that will evolve, and there will be more partnership at different levels of government. But the adequate resourcing of the service, making it 24/7, expanding it citywide, has been a really important way for us to be impactful. And on that note, as was just mentioned by Andrea, we have done a lot of evaluation. We have kept a very close eye on how the service unfolds and the impact that it's having. And we've been able to demonstrate that this model works in our city. And that is why we continue to exist, why we continue to grow, why we continue to partner across all of the emergency services and in the community. And we hope to continue to be able to do so in the future. I'll stop there. Our information is here in case you have any questions or you'd like to connect with us afterwards, but we're also, we have some time now, Kate, I believe, to take any questions that have come up.
That's great. First, please let me thank you very much for the presentation. And it's very inspiring, the work that you've done, especially, from Social Planning Council's perspective, all of that community consultation and bringing the community along with you is obviously speaks close to our heart. There was an earlier question that I'll just answer in case other people are having the same questions. We did record this, and we do have everybody's contact information. So even the folks who weren't able to attend will get the recording, but also we'll gather the papers and things like that that have been mentioned in the presentation and send that along to everybody as well. So I'm going to combine, I think, the first two questions in a way, because I think we knew that this was always going to be a question, because people are really interested in how that 211, how, and the direct service, how does that all interact with each other? So maybe take a few minutes and explain a little bit more. But there was also a specific question around the 211 that you have in Toronto. We have 211 here, but in my understanding, it's nowhere near as robust. They're talking about how do you provide services in 150 languages? Like, that's incredibly impressive. So I know 211 is just a partner, you aren't speaking for them, but any sort of information that you can give us on just how those different interactions or those different points of entry into your program.
Yeah, happy to. So as has been mentioned a couple of times, 211 is our primary door, and all of our public education efforts have been around diverting people to 211. That's in part because that's the fastest way to get to us, but also one of our strategic goals was to lower the number of calls that were coming in to 911 so that 911 could focus on the calls that were most appropriate for them. However, we still get lots of calls through the 911 channel. And so what happens is 911 does an assessment. They look at the particular call types that we've agreed to as appropriate. They determine whether there is a threat of violence or weapons. Our crisis workers don't have weapons, obviously, and they don't have like bulletproof vests or anything like that. They have training on how to keep themselves safe, situational awareness, and they also have the training to escalate to 911 should a situation become more dangerous or more information is shared and it becomes clear that this is out of scope for us. So what happens is 911 makes that determination, then it goes to 211. 211 will ask further questions. They may ask things like, when we get to your house, is there a dog that we need to be aware of, right? So they're going to go a little bit deeper. They will also ask more questions about the situation. And sometimes in that conversation, it may come out that there's new information or the situation escalates. So we have a protocol by which that call is then rerouted back to 911. So that's how that process works. I think hopefully I've answered some of your questions around that. The question of 211 itself, yeah, so 211 is a community-based organization. So they are outside of the City of Toronto. We fund them as we do for all of the other community anchor partners to deliver the service. And they have we chose to partner with them because of the fact that they are able to deliver the service in multiple ways. They have a call center model that they've already been using for many years. They have a database of 60,000 different services and organizations that they can refer people to, because sometimes it's a matter of in the conversation, it may come out that they actually just need to know where the nearest food bank is. Right? They're not going to wait for a crisis team to come because their crisis is that they can't feed their children. So it's more important for them to be able to get information about where to go. And so 211 is able to do that. And that is also the strength of partnering, or the benefit of partnering with them. They're able to navigate people should that be the appropriate thing in the moment. Yeah.
I'm wondering, and because I think it feeds into, sorry, I'm not taking over the questions, I swear, but I think it was, I think it, from my perspective, I'm sorry, I will, a little bit more explanation around that threat of violence. What does that mean?
Yep.
Because of course, no situation is going to be clean, right? And everybody wants to take care of their people, but we understand what can happen when the risk evaluation, because the bar is set so low that then we're once again just forwarding everything to the police. So
Yes.
anything that you can add to that?
Absolutely. Yeah. So yes, that is a challenge that we faced early on in our pilot stages, I would say. Yes, I think the training that Toronto Police Services gets is really about assessing for and addressing and reacting to violent situations or potential for violent situations. And so having to redefine what that means and really look at what that means was a challenge, and continues to be ongoing work between the two of us. So 911 call takers ask a number of questions. Are there any weapons present? Are you planning if there's suicidal ideation, for example, they may ask questions about where they are in terms of actually taking any actions related to that. So they'll ask questions like that. Similarly, when it gets to 211, they'll say, do you want to hurt yourself? Do you want to hurt someone else? Do you have any weapons? But again, as Kate, you mentioned, the situations are dynamic and they evolve. Toronto Police Services is also aware of that. And that's why it was really important for us to build in the escalation protocols. And as Andrea mentioned in the evaluation, we actually saw our teams escalate in very few instances. So and part of that is our training. It's our ability to de-escalate. It's our ability to do that assessment and determine that this is an appropriate call for us. There isn't any danger here. And I think we've had some really interesting conversations around the weapons piece, and it continues. We respond to calls in people's homes. One could argue that one's home is full of weapons. Anything can be a weapon. And so we've had different conversations around that. And really, at the end of the day, we do our best in the assessment process. And then when our teams get there, they also have to be really conscious of how the call is going, where they are in the room, how they're positioning, where their back is, where their front is, that kind of thing. And we've learned a lot from police about those kinds of things too, and how to keep themselves safe.
All right. Fabulous. There's a very technical, you may not have the number and we can get it back to them, but there was a question of, do you have the percentage of calls that someone is calling to have an intervention on behalf of someone else? So I guess that well-being check call. Do you have, if you don't have that data at your fingertips, we can certainly pass it on. It's up to you.
Andrea, I don't know if you have it straight away.
Yeah, so I believe the question is about like which is like a first party caller or third party, like yourself or someone else. So 211, when they collect the information, it's not always available, but from the issue that they do have, it's about 18% from the pilot start to end of 2024. So it's people are calling on behalf of someone else. So like someone like a relative, a friend, or just like someone that they see like on the street passing by.
So it's primarily first person callers. I'm calling for myself. But in 18% of the calls, it may be, a neighbor calling to get a wellness check on their neighbor or a family member, or again, someone on the street, because you're seeing someone who could use some help.
Okay. Thank you. I'll just build a little bit, ask one final question that it's curious in my mind, because I really appreciate, how you're working with the Toronto Police Service on this, because it's just, it's got to happen that way. But I'm wondering about that last interaction when things do have to escalate. Is it that automatically the police then show up and they are kind of, now it's their call and they're in charge? Or do you have the ability, like you've built that relationship that if we want to call you, but you're still in the background for a while? Is that something?
Yeah. So our joint training that Leanne referenced, we do joint training with Toronto Police Services. We do all kinds of, information sharing with police services. We go regularly to their huddles, which are called parades here, and share information about the service. And I'll be really honest with you, most of the time, officers are really excited about the service. They acknowledge that perhaps they are not the appropriate service to respond to many of these types of calls. And their questions are more around, the nuance in those calls, around escalation, around safety, around, is this a you call? Is this a me call? So we do have a collaborative, I think, learning relationship at this point, and that flexibility to continue to evolve that relationship and evolve our learnings together. But our joint training specifically is about that. So it's like we both find ourselves on scene together. Now what? And so we really work on communication and trust building. And it may be that, I'm going to be, TCCS is going to respond to this as the primary because we've built some rapport here and this person trusts us, or they have had a negative experience with police in the past and they're going to get triggered and it's going to escalate. So it's better if we do it. And police, in those scenario-based trainings, they have made those same assessments, right? I'm gonna be back here. and they'll say, they'll act it out and they'll just say, I'm right here. I can't leave, but I'm right here. And if you need me, let me know. Sometimes though, the situation is a little bit different and they might say, we need to do a safety assessment. So you need to step back. And our staff are trained to do that as well. They'll say, okay, tell us how far back to go. Do you need us to go to the car? Do you need us to go, 30 steps back? And that communication in the moment and that flexibility around what needs to happen is really important. And what we really emphasize is that it doesn't matter that both of you are on scene now. What is happening to the person in front of you, and how can you work together or separately to make the situation better for this person? And I think that is common ground always in the room. And so working from that space, either in those simulated experiences or on the ground, has really helped us to be able to manage some of those conflicts.
Thank you. Sorry for the folks. I didn't realize other questions had come in, so I'll try to do these very, very quickly. No more editorializing. And I want to thank Tammy from 211. I had no idea. Apparently, we have the ability to translate into 240 languages. I did not know that.
There you go.
So thank you very much for that information. And they are already reaching out to TCCS about the Manitoba model as well. So fabulous, great minds think alike and all that. We have an anonymous attendee asking about your budget, because it does come from the city. We have the same issues that you do here with the city of Winnipeg saying that's a provincial matter. We can't pay for it. We can't afford it, that sort of thing. So are you prepared to share like what's your annual budget like now?
Yeah, so it is public information. It's in the city's the city does publish its budgets. We are now at just over $30 million for the service. Again, directly from the tax base. We are also in conversation with different levels of government about support, because this is, as I said before, this is not entirely the jurisdiction of the city, but I think politically, as well as the community, felt like it needed to happen now. And we'd been asking for a long time, and it just we had to figure out a way, and this was the way. We will continue to have those conversations around shared funding and responsibility over the service, but so far it is directly from the tax base.
Fabulous. Thank you very much for that. And the last one, do you have an estimated or like a time for call? Somebody is asking about how long does it take to respond to a call, especially with the transfer of calls? Do you find that that's too slow, or where are you at with that?
I'll let Andrea answer the question around the call, but I'll just hand it over to her.
Yeah.
Hey.
Yeah, so the average call duration is about 11 minutes when the person calls the service or is transferred to when the call ends. Within like the wait time is around 2 minutes. That's from like the pilot start to like right up until the end of last year.
And the average time it takes us to get to the person is about 33 minutes.
Without sirens.
Without sirens in this traffic.
As you said, that's right.
Yeah.
In Toronto,
it's not bad, right?
We're smaller in Winnipeg. We could probably do better than that, only because of our size. Last one. If you got two, like it's 12:59. Toronto, you can stay for a little bit more. Okay,
Yeah.
so one is would you are you able to share, is it public information, like the actual, I think they're asking for the actual training, like you listed the different kinds of training do you have, but is that something that TCCS would be like, this is literally how we train our folks? Is that something that you share?
We not the full details of the training, but we can share high level kind of synopsis of what's included in the training. So if that person wants to reach out to us directly, we can share some of that information. But the trainings are so they're not done. Not all of them are done by us. We hire experts to do the training for us. Some of them are done by our community anchor partners who have the specific expertise. And so they would develop the course jointly together, and then and we would deliver it. Yeah.
And for the folks, for the larger audience here, just so you know, like the PAC's position is, and having spoken to TCCS, there's lots to learn there. There's lots to learn from what they've already done. But we would talking about, replication as opposed to duplication here, because we would still have to do all of that work with our community as well here and taught. So it will look slightly different here, just as other non-police led responses look in other jurisdictions as well. So that's the conversation that PAC is hoping to get started with through this presentation, that we can actually, what is needed here in Winnipeg? Yeah, because we'll be slightly different. And then the last question is just if this is more practical. Was any comment provided on current staffing numbers, i.e. crisis team members? Secondly, with the set of prerequisites informing potential applicants, what are enrollment numbers?
Great question. So we have over 200 staff currently. That does include some of the, supervisors and managers and data folks that exist, and that's across the service. Our team is quite small. It's 5 people currently at the City of Toronto who manage the kind of, service system navigation piece of it, or service system management piece of it. Each of the community anchor partners does their own hiring and recruitment, and they have slightly different qualifications that they're looking for. For example, our Two-Spirited People of First Nations, is trying to recruit people that represent the community and have experience working with Indigenous folks. And so they may have slightly different requirements for who works there. We also have peer workers that are part of the service. So it's possible to kind of come in with a different set of experiences, lived experience, for example, and then get trained and have the experience to move into other areas. Yes, Leanne just messaged me that, we also have elders and knowledge keepers and other folks who provide that kind of expertise. So the teams truly are multidisciplinary. We may have a social worker, we may have a nurse, we may have a peer worker, and we may have a crisis worker. So the teams are made up of different types of people, always trying to have representation for what the city looks like. We heard from the last evaluation that we did that it was really important for folks to be able to see that representation, see themselves represented in the crisis workers. It made a real impression on them and their experience of the service. So I don't know if I've answered. Oh, is it hard to get crisis workers? Maybe that's the question. So I will say yes. It is difficult to recruit. This is not easy work. It's frontline work. There's lots of vicarious trauma, first-person trauma that can be experienced. Some folks can't do it for a long time for those reasons. And so there's always hiring going on, but we also have folks who've been here for a long time who are really passionate about the work, who really enjoy it and are kind of in it for a while. And so it is a little bit of a mix, but from what I see, the teams are always hiring. So there's always opportunities to do this work.
All right. Well, I'll end by thanking you again. The last was not a question. Again, it was from one of our founding members of PAC who just wanted to also express their thanks. This is the kind of vision, this service is a vision that many of us share here in Winnipeg. So I just wanted to thank you all for sharing what you've learned, because I do think we can absolutely build on what you've done and created. And you should be so proud of yourself, because I'm sure this was not easy in those early days.
Thank you so much. We really appreciate the opportunity to share our experience, and we wish you all the best in your efforts as well.
Thank you. Take care, everybody. Thank you to our audience. Thank you for joining us. You will get the recording. All the best.
Bye-bye.